We know that several human rights groups have been marching to the Ministry of Health and then now to the Kenyatta National Hospital, of course, to protest the current state of health here in Kenya. This, of course, being spearheaded by the allegations leveled against the Regional Referral Hospital, KNH. Mortuary staff had been accused of sexually harassing female patients there. But so far, at least what we've heard from the committee chair from KNH, they have not heard of any reports filed with the police, no official reports being made by affected patients. The Ministry of Health has said they will be investigating the allegations. We expected a report yesterday from the Ministry of Health in terms of their findings. What you're seeing, at least to the left of your screen, live footage of the human rights groups who made their way now to KNH, and they're calling for a cleanup of public health facilities across the country. They are also taking a petition to the Cabinet Secretary for Health to respond to many of their concerns that they say don't just touch KNH, but also touch on various health facilities across the country, and they want that addressed immediately. Of course, security coming up as a huge issue, a huge security breach, at least in terms of the allegations that came from patients, many of them mothers who had just given birth, many of them who had gone through cesarean section and were heading down to the first floor where the incubation for their newborns was to breastfeed. Many of them caught up by the mortuary staff around 2 or 3 a.m. in the morning and unable to run to safety. So many questions as to what happened in terms of security to ensure that patients were indeed safe. What you're seeing now on your screens, live footage from Kenyatta National Hospital, where human rights groups have gathered. They were making their way from the Ministry of Health. They wanted to have audience with the Cabinet Secretary for Health to give a petition. In that petition, the biggest issue for them was a cleanup of public health facilities, proper security measures, a complete overhaul of the healthcare system here in Kenya, and as well an audit of employees to know who, in fact, they are dealing with. So you're having a clash, if you will, of two groups, the KNH staff defending their position at the Regional Referral Hospital, and on the other side, human rights groups calling for justice to be served, at least for the patients who have been affected in these scathing allegations against KNH, and of course a complete overhaul of the health system here in Kenya. Let's just listen into the happenings there at KNH.
Wasaliti idleness. Hamuna kazi mmekuja kukusumbua. Hamuna kazi idleness. Wasaliti nyinyi. Endeni huko.
Who have been marching throughout the city streets with the intention of presenting a petition to the management of the Kenyatta National Hospital over the rape allegations that have been awash concerning this institution. We have been marching with them from the Freedom Corner in Uhuru Park to the Ministry of Health, and finally here at the Kenyatta National Hospital. There have been attempts by this group to gain access into the compound hosting this institution, but those efforts have been thwarted by security officers who locked the gates as soon as they saw this group of protesters, mainly women, some of them carrying placards, many of them carrying placards and wearing t-shirts that actually denouncing what they say is the rape culture that has been ongoing here at the KNH for years now. What you can see right now, Victoria, is as we speak right now, there is a standoff between the demonstrators on one side of the gate outside the compound and the staff of the Kenyatta National Hospital inside the compound. Both groups, of course, are trying to make their voices heard. The demonstrators, of course, speaking out against what they claim are these rape allegations and assault of patients and mistreatment of patients and generally poor handling of those who seek services here at the Kenyatta National Hospital. On the other side of the gate, inside the gate, of course, are members of staff who are rebuking and saying that these allegations as presented here by the human rights activists are not true. They say that they do not rape patients, that they give the best health care they can under the circumstances. So we're waiting to see what will happen, because this group of protesters that has been marching through the streets is pretty insistent in delivering that memorandum, that petition to the hospital's management. We were able to speak to the Director of Communications here at the Kenyatta National Hospital, who told us that they will not allow these protesters inside, but instead they will have an official come and take that petition off their hands and deliver it to the management of the hospital. So we are waiting to see how this scenario plays out. But despite this confrontation, the bottom line, of course, remains the very weighty issue of patient care, patient safety at the Kenyatta National Hospital and indeed other health facilities across the country. Victoria?
And Brenda Wanga now, of course, speaking to us over the phone on the situation there at KNH. But Brenda, you mentioned, of course, they're protesting against what they're calling this rape culture, silent rape culture at KNH. But beyond that, what more are they asking for in that petition? Are they looking for an overhaul of health services across the country, security? What more do they want?
Victoria, I think over and above the fact that they are demanding that this, what they call the rape culture here at KNH stop, they're also demanding that the safety that they can, what they're asking for also is the fact that they want the patients to come here, especially mothers who have come here to deliver or seeking maternity services, should be afforded assurance that they will be safe, that they will not suffer at the hands of either hospital staff or strangers who have been known to make their way into the hospital. They're also demanding that the mothers and their newborn babies are placed in on the same floor. That has not been a situation in the past. We find mothers moving from one floor to another floor to access their babies and feed them. They want this overhaul. They want this amongst other things, Victoria. So let's just listen into what these protesters and their leaders are saying at this moment.
I don't know if you'll be able to. All right, live pictures from Kenyatta National Hospital. Two opposing groups inside KNH are staff who are demonstrating against allegations of sexual harassment and sexual assault from patients. We are yet to hear, of course, concrete allegations made by patients in terms of filings at the police. And then, of course, on the other side of the main gate are human rights groups who are protesting the current state of health here in Kenya and, of course, the allegations at KNH. Let's listen into what is being said by the human rights groups.
And the following are our demands. We demand an apology from the management of the hospital and the CEO resigns. As thorough and proper investigations must be conducted. Victims must get justice and the criminals must be brought to book. Infants are moved closer to their mothers. Space should be created for that. Security, safety. More security officers should be deployed to the facility and placed in the strategic places. The corridor should have enough light and security cameras should be installed. More funds should be set aside for health facilities in the country to reduce congestion and to enable the